a brand new show that just dropped. While the presenters play dominoes, a special guest will be discussing all topics that matter to you. Everything from judicial, legal, health, wealth. Nothing is off topic. The name, you ask me? Domino Effect. Domino Effect. Come listen. It's time well spent.
Good morning, good afternoon, and good evening. Whatever time you're watching, welcome to the Domino Effect Show. While my friend and I play the domino,
Hold on, I didn't go yet.
we'll tackle a hot topic. At the table, I have Sweet Will and I have Vods on my left. Today, we normally have Nurse Pat to talk about some sort of health issue with us or some sort of anything to prevent. But tonight, we're going to talk about something an experience that Nurse Pat has gone through, and she's going to talk to us about it. And I'm sure we just would hope that none of your wives have gone through that. It's breast cancer. So, in the past few months, Nurse Pat has gone from being diagnosed with breast cancer, had surgery, and she had radiation, and now she's on the table and playing with us. So Nurse Pat, we are happy to see you on the table with us and recording this show. We are very happy to have you on the table sharing this experience with us. So, fellas, the table is Nurse's Pat and yours.
All right. So, back in December, well, this journey started 7 years ago when I went to the doctor and said to them, hey, I have an itch. The itch is internal and it's driving me nuts. And they're like, what do you mean? I'm like, it's internal, really, really deep inside. Like, I can't scratch it. It's deep inside my breast. And they're like, okay, you're at an age where you can have a mammogram. They did a mammogram, found nothing. I kept telling them, but it's there. I feel it. It's annoying. Lady, you might be a little bit crazy. I'm like, okay, something is there. There's something that's driving me nuts. I kept saying there's something there that's driving me nuts. They couldn't find it. But because I was of a certain age, they continued to do mammograms for me. So some of the ways that they can test for breast cancer is with self-breast exam that you would do every month. And they would recommend that you do it around the time of your menstrual cycle. And my turn. And when you do it around the time of your menstrual cycle, and then the next thing that they would recommend is if you have an issue, you would have a mammogram. If the mammogram has an area of concern, you would have an ultrasound. The ultrasound would show more. Then you could have an MRI that would show a more detailed picture. And then based on the MRI, they would send you to get an ultrasound-guided breast biopsy, which is they're doing a biopsy as they're taking a little piece. Or they can also do something that's called a stereotactic breast biopsy. The stereotactic breast biopsy, let me just tell you this. It hurts like hell. I've had an ultrasound-guided breast biopsy, and I've had a stereotactic breast biopsy, all done on the same day. The stereotactic breast biopsy is you're having a mammogram. A mammogram is just basically, this is what they do. They take your breast, they put it in between two plates, and they squeeze to get a photo. It hurts a lot. It's like Okay, it's like you taking, you know, banan, you're making plantain. You finish frying it, you take the plantain and you put it in the tostonera to flatten it out.
Would they do the same thing for men? Because as men that don't have breasts,
they'll find a way. Where there's a will, there's a way. Because there's some women that don't have a lot to work with. Because just some statistics, there's 1 in 8 women that will be diagnosed with breast cancer. So it affects people. It's a club, it's a sorority I didn't want to be a part of. So fast forward to this past December when they did the mammogram. The first thing that I said to the padre before I had the mammogram done, I said, they're going to tell me that I have breast cancer. He looked at me, he said, what? I said, well, since I don't have a 6-pack, see, I accept life as it is, and I take on life in a joyful manner. So I said to him, well, since I don't have a 6-pack, I'm finally going to have my tummy tucked because they're going to tell me I have breast cancer. They're going to take away my breast, and they're going to take fat from my abdomen to recreate my breast. Is that not what I said to you?
Yeah, you did, yes.
I went and I had my mammogram done. They told me they found an area of concern and they needed me to come back to have an ultrasound done, which we spoke about the ultrasound at the beginning. I planned the ultrasound and I said nothing. I said nothing to him. I said nothing to our son. I went and had the ultrasound done. The minute I was having the ultrasound, I'm looking at what they're looking at. And I said, oh, shoot, they're going to tell me I have breast cancer. They're going to tell me I have breast cancer. They came back in the room and they said, hey, we need you to have a stereotactic breast biopsy, ultrasound guided breast biopsy. You're going to sit down with somebody that's going to explain to you what's what. But I already knew what was what and how to do it and everything like that. So when we went and I had all of these done, the day that I had them done, he didn't know what I was having done. I went and had them done. And when they called me on the phone and gave me my results, I already knew the results. I already knew I had breast cancer. I cried for all of 2 seconds, and then I was like, why not me? I had clinical to teach. I had students to take care of. I had my home to take care of. I had everything to do. And my only concern was, what's the next step? When do I have surgery? Can I schedule surgery? Can I make sure my students are okay? Can I make sure I can still teach my classes? Can I make sure? Can I make sure? Can I make sure? Can I make sure? Can I go to the gym? I hate the gym, guys. I hate the gym. I hate the elliptical. I hate anything to do. But I was still going to the gym and still doing the stuff that I needed to do. But I wanted to know, can I go to the gym?
Now,
what can I do?
Okay, what are the main type of breast cancer?
So there's 3 types. There's the first one, which is ductal carcinoma in situ. That's stage 0. Stage 0 happens when it's the abnormal cells are inside the milk duct. It hasn't spread to surrounding tissue. Then there's invasive carcinoma. Right? Invasive ductal carcinoma, IDCIS. And that one, it has already invaded the milk duct and the surrounding ones. That one is stage 1. Then you have stage 2 to 4, which is the lobular invasive carcinoma. And that, you know, when you go to from stage 2 to stage 4, it's more invasive, it affects more areas, and it can spread to more areas, and it's a bigger size. So I had stage 1. Stage 0 is typically treated, for some people, stage 0 is treated with, let's watch and see, let's keep an eye on it. Sometimes they remove it, sometimes they recommend you for radiation. For myself, mine went from them telling me that they needed to do a mastectomy, which I was fine with. Then they told me, no, we don't think it's that big. Let's do an MRI to find out how big it really is. Then they told me, you know what? We did the MRI. We don't really think it's that big. let's 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 do surgery, and then maybe we might do some chemo. And maybe it was like a lot of maybes until they went in. When they went in, the size that they thought it was, I didn't end up having a mastectomy. I had a partial mastectomy. All the restrictions they told me I would have, I didn't have all those restrictions. Because when you have breast cancer, the ways that they can treat you is through surgery, which you can have a lumpectomy, a partial mastectomy, or a mastectomy. A lumpectomy is a little piece of it is removed, and they check to make sure all the surrounding tissues are taken. Or they can do a partial mastectomy, which is part of the breast is taken. Or full mastectomy, the full breast is taken. With all of these, they can do reconstruction. The treatment options, they can do radiation, they can do chemotherapy. Radiation is when you're going into the machine and rays of radiation are being targeted in a certain area. Chemotherapy is when you're giving these drugs. They can either do oral chemotherapy, or they can do IV chemotherapy. You'll lose your hair, you'll lose your sense of taste, you'll lose your energy. You'll be a mess for a while. You'll be a hot mess for a while. With radiation too, because the first week you're okay, the second week you're nauseous, you're tired, you don't want to do things. And then after all of this, when you go for your appointment where they have to do a scan to check your body, you meet Ned. Ned is your best friend. You want to meet Ned.
And what is
at the end of your treatment.
And what is NED?
NED is no evidence of disease. NED. And when you meet Ned, you'll be getting on your feet and thanking God and saying, you know what? I'm happy I made it here. No matter how sick you are, you're happy. You want to meet Ned. So when you meet Ned, though, you have the next 5 years that you need to work on, because you need to take the maintenance medication, which they'll either give you tamoxifen if you haven't hit menopause, or something else if you've hit menopause.
So Ned, is that when I see those people ringing the bell?
When you're ringing the bell, that's when you finish treatment.
Oh, okay.
That's when you've completed your treatment and you don't have to go in there anymore, because going to radiation was hard.
I listened to you, and I just want to say to our viewers, everyone that watching, and we thank you. I know it take a lot and to come here and talk to us about this. And like the Padre said at the beginning, he prays that none of us go through what you guys experience. So I have a question. It's for both of you guys. You know, and I have a question for Padre. As a husband, and when your wife came to you with that news, and we know that in the culture that we grew up, and when we talk about cancer, regardless what type of cancer, it's a big deal. So what was your state of mind? Like, how did you deal with it, and how you dealing with it right now?
To be honest, I'm the kind of person that hold things to myself a lot of times, and I was kind of like, what am I gonna do now? And when you hear cancer, the first thing you think about is death.
Yep.
And I'm not gonna lie, and I'm not gonna sit here and lie about it. And I spent every night praying. I'm like, God, I don't know what I'm gonna do.
Yeah.
You know, and I'm sitting. I'm like, okay, if that's what's gonna happen, I guess it is what it is. But one thing I said, it's better that it happened to us than it happened to somebody else. The reason why I say that is because we have insurance, and that's because we had insurance. That's how they are able to find out a lot of things. But if somebody didn't have insurance, they could be sitting on something like that for years, and then it could move from one stage to another stage. You know, you see what I'm saying?
Yeah.
So that was the second part of the way I was feeling. And then I moved from being helpless to, it's like, okay, she's gonna need somebody to like support,
Yeah.
like the role that I'm supposed to be, the support system.
Yeah.
And of course we have an 18-year-old
Yeah.
who's in college. So
Yeah.
how are we gonna tell him
Break that news
we're
to
gonna
him.
break that news to him? So it was like, okay, so how do we handle that? You know what I mean? Because we don't want to stress him out. He's in the dorm.
Yeah.
And this kid and his mom is like, it's like white on rice.
Yeah.
He texts mom all day, all time, and he goes like, oh, if he's gonna go use mom's credit card, oh, I'm gonna go. Can I use it? So now, if he comes home and he can sense mom is weak, he's gonna ask the question.
Yeah.
You know what I mean? So how do we handle that? You know what I mean? So it's like, okay, the decision was not easy, but and I'm gonna say this, if somebody is going through this, there's a lot. I mean, as men, a lot of times we think we're tough. It's not an easy thing to go through when your wife has cancer, whatever stage cancer it is.
Yeah.
You know what I mean? 1, 2, 3, whatever it is. And if you're not ready to be a supporting husband, and I'm gonna say, don't get married. Straight up. I'm not gonna lie to you.
True. Because
You know?
one of the things that was hard.
That would be one of the same question for you
One
too.
of the things that was hard for me. Well, no, it wasn't hard for me because I'm a caregiver. I made sure that I didn't tell a lot of people.
Okay.
I didn't tell a lot of people because I wanted it to be. I played already. It's your turn. I wanted it to be my story on my term, and I wanted to share it how I wanted to share it.
Okay.
Like when I spoke to Padre and I was like, okay, we need to tell Matt, but I want to wait for his exams because I don't want to tell him and then I mess up all of his exams. So, but I had to go pick him up. So I'm like, how am I going to do this? So I picked him up and I said, hey, you know, it's going to be difficult. Mommy will not be able to pick you up because I won't be able to drive. He's like, you won't be able to drive? You driving now. Did your license get taken away? And I was like, no, my license didn't get taken away. I said, my license didn't get taken away. I'm sick. He was like, you're sick? What's wrong with you? So I told him, and he said, oh, that's when he got like really quiet. He said, are you going to die? I said, no, Matt, I'm not going to die. I said, I'm perfectly okay. He's like, so what are they going to do? How are they going to do it? So when I explained everything to him, and he was very understanding. But the thing to me that gave me perfect peace was the day of my surgery. The night before, because I record a prayer and I send it out to friends and family. So the day of my surgery, the night before, I pre-recorded the song that I was going to use in the verse. I did that. I got up 4 o'clock in the morning. I have to be at the surgical center at 6 a.m. Got up, did the prayer, sent the prayer out. Didn't really tell most of the people on that prayer list what was going on. So I did my prayer thing, sent it out, and we went. I had a friend come from far, come and meet us in the snow, and we're in there. You know, we prayed. My doctor came and he heard me singing, and he was telling Padre, "Oh, I'm used to her. I've performed surgery on her before, and she's typically singing. You know, we know it's her." So after I got out of surgery and I turned on my phone, one of the things that brought me so much joy and so much peace was the fact that Matthew sent me a message and said, I was praying for you. And I had told some of my friends what you were going through, and they were praying for you too. So I hope your surgery went okay. I'm like, okay. I said, you know what? Even if I didn't make it through, my son was going to be okay, because here he was praying. He was
Now,
praying for me. So.
Was it beneficial the fact that you yourself is a nurse and you knew exactly, like, what to do, what to expect? Because some people, the fact that, like, if I tell my doctor, "Here, I feel this," and they do one test and they're like, "You good."
No.
But you coming back and be like, "No, what I need you to do is this, like, you know exactly,
it
like,
wasn't.
step by step
because
and whatnot.
even when I was diagnosed, there were certain things that I needed that I did not know about, that I did not receive. Because see, as a nurse, I specialize in certain areas. There are certain things that I know, like I know, as a nurse, you're taught everything. But there are certain areas that you specialize in. There's certain areas that I specialize in. Like I can tell you, I didn't know as a breast cancer patient that I have the right to 2 post-mastectomy or partial mastectomy bras every year from my insurance. I didn't know that. I didn't know.
Can you repeat that again?
I'm entitled to, per my insurance, I'm entitled to 2 post-mastectomy bras every year.
Can you say
what does that mean? Like 2 different?
That means one of them for everyday wear and one of them for sports wear. And those bras are bras that you wear because they help with swelling, they help with movement.
Specialized.
They're specialized bras. I'm entitled to that. That's
so
my
is that gonna prevent?
It doesn't prevent anything. It's a cosmetic.
Swelling. It prevents swelling and it helps with comfort.
So that would be my next question. And sorry if you have not finished and so and say it well. It's just like based on statistic, and correct me if I'm wrong, and it's more affected black women that who have breast cancer that I observed.
Nope, because where I went, when I went to have surgery, I was the only black woman there.
Okay.
I went to there's something in Worcester where they did something, Pink Revolution. I was 3 weeks post-surgery. And I had signed up to go to this thing prior to even knowing I had breast cancer.
Wow.
I signed up. I was going to support breast cancer. Here I am, I have breast cancer and I'm going. I said, okay, I'm going. Wow. Padre was at work. I'm like, I have to drive myself to this thing in pain. I'm like, okay. I got dressed all in pink, bright hot pink. I show up to this thing and they're looking at me. They think I'm one of the presenters. I'm one of the people. And I'm like, no, I'm just coming in. Wow. Do you know I was the only black woman in the room?
I think it's
I was the only black woman in the room.
So what?
And I'm like, okay, another black woman showed up. But when they had all these people standing up, none of them were black. Okay. I was like, I said, okay, so I'm an anomaly. It does affect black women, but I don't think it affects more black women than it affects white women.
Okay, what's the cause of it?
You cannot turn around and say it's because you hit something. It happens. It can be genetics, because I can tell you in my case, I knew I could get breast cancer because my grandmother had breast cancer, my grandmother had leukemia. I knew my family history. I have 2 aunts who had breast cancer.
I just want to make sure that.
But when they did the testing for me.
Gentle next time, you know.
when they did genetic testing for me, it showed I don't have any of the genes. I don't have any of the family genes that are cancer causing.
All right. So now that you said, I know you give us stages of breast cancer. How are they determined?
They're determined based on the pathology. So when they turn around and they take that biopsy, the biopsy is able to tell them.
Okay. I'll be honest, cancer is not something like
you like to talk about.
Yeah, like, you know what I mean? I don't like honestly, it really makes me uncomfortable because it's just one of those things like when you hear it doesn't matter if it's breast cancer, whatever. The minute you hear cancer, it's one of those things. You hear,
like I said.
Yeah, exactly. So when somebody tells me whether it's first, second, third, fourth stage, whatever it is, the minute you hear cancer, it's just like, Man,
yeah,
like,
your
you
turn.
know, I mean, it hits. It doesn't what stage it is, but it just hits hard.
It does.
You know, so.
Because one of the things that really bothered me was that people would come and take a look at me, and I would say, oh, you know, I had breast cancer. And they would turn around and say to me, oh, you don't look like you had breast cancer. And I'm like, what am I supposed to look? Because here's one of the
Was I
things.
supposed to look like trash? And then for me to look like, am I supposed to look like I'm dragged? Like
I had surgery, and after surgery, they put me on a medication. I gained 20 pounds. Sorry, I'm going to touch a touchy subject. My mother-in-law came to visit, and one of the things she said to me is that, oh, look at you, you gained weight. Do you know what that did to me? I wanted to cry inside.
But in the Haitian community, when you gain weight, it's a good thing, especially when they're telling you like you sick. Gaining weight is like good job,
no,
you know what I mean.
It wasn't like that.
It sounds like
it wasn't.
You know what I mean?
It wasn't like that.
Because usually, if you're sick,
do you know what
you start losing weight, you start looking skinny and things like that.
No,
so.
she didn't mean it like that. So I turned around and I said, yeah, I gained weight. I said, Padre lost 15 pounds and I picked it up. I had actually gained 20 pounds. That's when I said, you know what? I need to speak to my doctors. I reached out, spoke to my doctors, and I said, something's wrong. Because there's no way. I said, you put me on a medication and I've gained 20 pounds. Something's wrong with me. I shouldn't be this weight. Something's wrong. I said, I'm walking 3 miles a day, 3 to 5 miles a day. Me. I'm doing cancer treatments and I'm walking. Why am I gaining this weight? Guess what? The medication, abnormal weight gain, is one of the side effects. They quickly took me off the medication. Within 1 week, I lost 10 pounds. And they're like, oh my goodness, she was correct. I lost the weight, went back to my normal. But it was like everywhere I went, people are like, oh my God, you look amazing. And I'm thinking to myself, listen, I get up in the morning, I do 30 minutes Tuesday through Friday with this man at the gym that I hate. On Saturdays, I go do an hour.
The fact that you knew that, some people wouldn't. The fact that you knew that, some people wouldn't know that. Because, like, you gaining weight is kind of like, good job. You gaining weight, that's a good thing.
Oh my gosh.
But the fact that you knew that you're losing weight, that like, something is abnormal, something is not. So, you know, I mean, for the regular people, they wouldn't. So they would still be on their medication right now.
No, not me.
Like we said earlier on, and we appreciate you come and to share this personal experience to us and to our viewers. We really appreciate it because there's a lot of people that is going through something like that, but because of lack of support and lack of education, and also it's personal. Not everyone want to share, especially with what they are going through, especially with the body, with the health. It's a very sensitive issue when it comes to that. So how do the healthcare provider support breast cancer patients during treatment and also survivorship?
So it's,
and also I want to add that question. And if someone, is there any support group or anything that someone needs?
There's more than you would think. So first I'm going to address the support group. There's the National Breast Cancer Council, NBCC. One of the things that council did, my case manager referred me to them. And then they turned around and said, hey, Patricia, we found a cleaning service for you. So while I was going through radiation, they sent a cleaning service to my house to clean my house once a month for 2 months at no charge to me. Another organization sent me a Hope Kit. The Hope Kit came with socks. It came with nausea medication. It came with chapstick. It came with something to spray my mouth because sometimes in radiation you get nauseous and then afterwards your mouth is dry. It came with a headband. If you're walking and you're sweating, if you're walking, the wrist cuffs. It came with a tumbler that you could put water in. The water is going to stay cold for you to be drinking. It came with crackers. It came with different little things that when I went to radiation, I could have with me so that I could use.
Okay.
It came with supportive things. That was the Hope Kit. There's the YWCA. The YWCA provides a free membership to breast cancer survivors or women undergoing treatment for breast cancer. And with that membership, there's also a class where you can go to water classes, aquatic classes that will help you with your emotion while undergoing treatment or after treatment. And they have a support group, I think, that meets on Tuesdays at between 11 and 12. There's also different support groups for breast cancer patients in different towns, and they meet at different times. Like I know the one in Worcester meets on Mondays at 6 o'clock. So because I'm doing different things, I haven't attended those support groups, but I know where they are. I know where the help is, because one of the things that they gave to me when I was diagnosed was a packet. Now, here's the thing. People don't think I do this, but I do this. If you give me something, I'm going to read it from cover to cover. Everything you gave to me, I'm going to read every word. And I'm going to commit it to memory and remember. So every patient is given the exact same thing.
Okay.
Like, this is who you can go to for support. Like, I didn't know those things existed, even though I'm a nurse, because breast cancer is not my domain. Lung cancer is my domain. So, breast cancer, having gone through this, I know there's other support. Like, there's the physical therapy support.
Okay.
You can go and be seen by physical therapy, because some women, you'll see some women going around, they have a sleeve on for breast cancer. You see their arm is huge. They had breast cancer, now they have lymphedema because they have lymph nodes removed. And now the lymphatic system draws away fluids and moves it around in your body. Now those lymph nodes have been removed. There's no longer that support. So all that fluid sits in their arm. So they have to wear these sleeves, these compression sleeves, to help redirect the fluid away from their arm, away from other places.
Oh, wow.
There's occupational therapy treatments for that. A lot of people don't know that. A lot of people have never gotten those treatments, but so they're wearing these sleeves. You see them if they wear a short sleeve dress, you see the sleeves, they try to make the sleeve flesh colored, but a lot of them are not flesh colored, and they're walking around with these things. Though I don't have much lymphedema, but because I had another thing, they sent me for occupational treatment.
Just in case.
I had treatment twice a week.
Well, that's the thing, like
for a period of time.
Certain things you don't know. If you've never been in the position,
you would not know.
You would not know
what kind of resources.
Exactly what the resources that's there. And then when you see something, if you never seen it, like you see somebody wearing it, you wonder, like, did they break their arm? Like, you know what I mean? You don't know.
Exactly.
You wouldn't know. But the fact that, like, you know, if you know somebody in the family had cancer and so whatnot, and then they're wearing it, and when you see it, you recognize, like, okay, she had breast cancer. This is why she's wearing it.
So can you
like
repeat the name of that organization that you said that?
I believe it's called NBCC, but I can look for it real quick in my email.
It's great information.
Oh my God!
We applaud you for that,
dude,
man.
I can't.
For your courage.
I can't think of it, like, dude.
For your strength. And
I don't know, man.
And if someone is watching and they are going through something like that, there's research.
It's actually called the National Breast Cancer Foundation.
Okay. There's research out there, and talk to your provider, and especially your primary care provider, for information, for group support like that, because there's a lot of information regarding this, because I think
if you don't know, you would never know, because somebody else knows, so you definitely need to find a resource to help you.
Yeah.
So
there's the American Cancer Association. You can reach out to them. There's Susan G. Komen Foundation.
Yep,
There's Live Strong with that Neil Armstrong used to be the face of. So Live Strong does things for women for breast cancer. It's not just testicular cancer.
Now I know there is a question that we were talking about off air. Does men have breast cancer?
Yes, it does affect men. It is not as common as men. That's why when a man comes with gynecomastia, gynecomastia refers to men who have enlarged breasts. who have enlarged pectorals.
So it's not men boobs?
It's man boobs.
Okay.
So they do keep an eye on it. They would go ahead and do some imaging just to make sure. But breast cancer does affect some men.
Okay.
It does affect some men.
So I don't know if we have any more questions because I know we are running out of time.
Sweet Will, do you have?
Oh no, I don't have any. Like I'm telling you, that subject,
he's afraid of the.
It's sensitive.
Some of the prevention, I know. One of the big thing is for women to breastfeed. I know. I saw this photo. It was funny because I saw it when I was I was working at Mass General and somebody had a poster and they were like, "Oh, that poster is offensive. You need to put it down." Was like, "Oh, you don't want to have breast cancer? Breastfeed your man. Make sure that man breastfeeds on those boobs so you don't have breast cancer."
So if I'm understanding this, so let's go back to our regular culture, Haitian culture. So the men. So the men can't caress the breast. Breast cancer is not caused because of a man is caressing the boobs too much.
No, that's not what's causing it.
Okay.
So
that actually
you can help prevent breast cancer by maintaining a healthy weight, exercising regularly, eating a healthy diet, breastfeeding is if possible, limiting alcohol, avoiding smoking, limiting hormone replacement therapy, because it is found in people that do use hormone replacement therapy, and getting the regular screenings and mammograms. Making sure that you're doing the self-breast exam. Making sure once you're 40 that you're getting that mammogram. Or if you know you have a family risk, that you tell your doctors so that you can get that early mammogram. And making sure that you're going.
But what if you do not know, you're in a family where you do not know? Because especially like growing up in Haiti, there isn't kind of like a history where,
you don't really
you know what I mean? It's not like every day somebody goes to get checked up and whatnot. You know what I'm saying?
So once you hit 40, your doctors will be telling you. So there are things that are called routine health maintenance. Once the doctor tells you that something is a routine health maintenance, following their recommendations and getting those routine health maintenance done. That's what it is.
Okay, so
because this was not an easy journey, guys. Going through radiation every day for the length of time that I went. There are days I didn't want to get out of bed to go.
I heard stories and such.
And y'all still made me come in here and sit here as ill as I was and record prostate cancer and testicular cancer, and y'all drove me nuts in Haitian Creole. Remember that?
Yeah.
Remember that?
Well, we appreciate your
You're saying my tenacity.
Your tenacity to help the community. we are very encouraged by.
Oh yeah, most definitely. We appreciate
your strength, your courage.
Because I'm not gonna lie to you, if I was in that situation, I don't know if I would be.
Not just that. It's not being in a situation, but the fact that like your spouse is going through it. It's kind of like it's one of those things like, what can I do? How do I make it better? How do I do this?
And you
can't do anything.
Here's the problem. You ready for the worst problem? You're married to me, and I won't let you do anything for me.
Yeah,
I don't know.
I won't allow you.
That itself.
Yeah. So she's the ultimate. She's the ultimate patient.
I'm the worst patient. You cannot do anything for me. I will not allow you.
It's a hard thing.
I can't.
So we thank you.
So,
all right, guys. It was nice being at the
thank
table.
You for sharing, Nurse Pat. Thank you for sharing your experience with us. I hope these resources and the message fall in good ears, and I hope the viewers that are watching the show tonight
The Women's Center. So the Women's Center in Worcester. There's also a Women's Center in Boston. There's also a Women's Center in the South Shore, in the North Shore. All those are resources that you can go to. There's also the Healing Garden. These are free resources that you can go to. If you have breast cancer, they can talk to you. They can give you other resources and guide you to other resources that can help you. Mass General has them. Boston Medical Center has them. Beth Israel Hospital has them. Leahy Clinic has them. You can partner with all of them. They'll be able to guide you and tell you where to go and what support system to find. Also, call your health insurance. Case manager will be able to guide you and tell you this is what is available to you. This is what is free of charge, and these are the costs for the other things.
Well, thank you and good night.
Good night.
Thank you, Pat.